Hello everyone, my name is Kyla Sanders, and I will be presenting health and illness in single parents. Some learning/behavioral objectives for you guys. By the end of this, we're going to be able to define health as well as illness. We're going to have a new understanding of single parents and their struggle with healthcare resources, and we're going to gain an understanding of how the healthcare system can be improved. Some background on this topic: there are over 9 million single mothers in the United States today. On top of demanding work schedules and childcare responsibilities, single moms face a higher risk of developing health problems than their married peers. Almost a quarter of U.S. children under the age of 18 live with one parent or no other adults, which is 23%, more than 3 times the share of children around the world who do so, which is 7%. Here's a quote: "Single mothers in almost all countries had poorer health as they reach older age than women who were married," said Bergman. "They have a difficult time performing simple things like climbing upstairs, getting around, and cooking." Here is a graph of the economic toll of single parenthood. To the left is percentage of families below the poverty line. At the very bottom, we have married couples with kids under 18. They range from about 9% to 5% from 1990 to 2010. In the middle, we have single dads in the blue with kids under 18. They range from about 23 to 15% below the poverty line, and single moms with kids under 18 are the highest. They range from about 45 down to 33 maybe. So as you can see, single moms consistently have a harder time staying above that poverty line. Single dads a little better, and then married couples have the best time doing so. Here are children in single father and single mother families by race and ethnicity. In white families, we have about 55% single fathers, 32% single mothers. In black families, we have 12% single fathers, 32% single mothers. In Hispanic families, we have 22% single fathers, about 24% single mothers. In Asian families, we have about 3% fathers and mothers, and in mixed races, we have about 4 to 5%. Some single mother statistics for you guys. 34% were poor, 25.9% were jobless, and 27.8% were hungry. So here's just a little insight of their day-to-day lives and what they go through. All right. What is health and illness? Health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity, a specific sickness or disease. Illness is a specific sickness or disease or an instance of such. Everyone strives to be healthy and avoid illness. For some people, this is an easier task than others. When sociological and economical factors negatively affect someone's health choices, these people tend to become ill at greater rates. A major aspect of someone's economic standpoint is if they have children and if they have a spouse. So single parents often struggle financially, leading to health issues. Healthcare practices and resources. Single women who have young children and full-time jobs and are without partners, perhaps because of death or divorce. If any of those women were to have personal health problems as well, the financial burden would be even greater, especially if the jobs were lost as a result. There would be health and utility bills to be paid, as well as food, clothes, and other life necessities to be acquired. Fortunately, there are many programs in place to aid single parents during these trying times. Some examples are TANF, which is Temporary Assistance for Needy Families, SNAP program, which is food stamps, FAFSA, financial aid, housing assistance for moms, mortgage assistance guide, and Women, Infants, and Children, which is WIC. These programs range from food assistance to housing to educational health concerns and circumstances. Single parents tend to fall subject to cardiovascular disease and addiction. According to a study published by American Journal of Public Health, employed single mothers are 40% more likely to have cardiovascular health problems. and 74% more likely to have a stroke compared to married moms who work. There are 70% more likely to smoke and have other addictive tendencies. Single parent poverty rates. The poverty rate for single mother-headed families in 2013 was almost 40%, 5 times higher than the rate of married couples. More than half live in extreme poverty on incomes below that of the federal poverty line. Nearly 35% of single mother families were food insecure, and 1/3 spent more than half of their income on housing. Single parents across all income levels are more likely to have lack of health insurance. In 2013, more than 20% did not have health coverage, compared to just 10% of married parents. Nearly half of these families reside in states that have declined to expand their medical programs. The more time women spend parenting alone, the more likely their health will worsen as they age, affecting their ability to do even the menial tasks. Behaviors and beliefs. So there are many misconceptions when it comes to single parents. When people see a single parent raising a kid alone, they often make a lot of false assumptions about them. Here are some quotes that single parents might have to deal with other people saying. Number one, they shouldn't complain. They didn't fight hard enough for the relationship. So these are people who impede on they feel like a single parent made a choice to be a single parent, didn't fight hard enough to be with whoever the other parent is. Number two, those children are at such a disadvantage from peers of theirs that have both parents in the home. I read a lot of articles talking about how single parents really want to get rid of the stigma that they face day to day. A lot of people feel like they are at a disadvantage, or are putting their kids at a disadvantage by not having both parents in the home. But I feel like a lot of single parents, their number one priority is to be there for their children and to take care of them in a way that two people would. So yeah, a lot of single parents take offense to these ideas, because it makes them sound like bad parents because they're doing it by themselves, when in reality they're working twice as hard as coupled parents to be both for their kids. And then this last one, she must be on welfare and underprivileged if she's a single parent. So this is more of like people who believe single parents are, using the governmental aid programs and abusing them. This is just another stigma that these people have to deal with day to day. Sociocultural factors. Given that 1 in 4 children now grow up in one-parent homes and 42% of marriages end in divorce, you might expect prejudice against single parents to be a thing of the past. Yet, a 2014 poll that found that 75% of single parents had experienced stigma. Stereotyping is the most common symptom of stigma raised by mothers from a range of backgrounds and circumstances. At the bottom is a quote from a single mother herself. I fell into that whole stigma of broken families. I was judging myself because I'd listened to opinions out there in society, the media, and policies at government level. Hypothetical character. All right. Suppose we have a hypothetical single mother. She got pregnant at 18 with a high school boyfriend. They were together for a year after the baby was born, but separated due to financial hardships. She gained full custody of the baby when the father did not show to the hearing. She has no contact with him now. She lives by herself and raises her daughter. She takes advantage of free daycare facilities in her community and works full-time as a receptionist. She has always been overweight, and so is her now 5-year-old daughter. She is subject to constant stigma about her being a single mother from everyone around her, strangers, family members, friends, and coworkers. She tends to skip checkups for herself because she has so little time after work and taking care of her daughter. One day, she finally makes it to a checkup, and she is told she has high blood pressure and is on track to develop type 2 diabetes. She is stunned by this news and is quickly reminded that she doesn't have healthcare insurance to cover her medications. She simply cannot add another bill to her load and leaves the office without any help. Like this hypothetical character, there are many actual women around this country who cannot afford medical care and rely on financial aid. Here's my professional journal article. It is called Single Mother Parenting and Adolescent Psychopathology by Isar Dariane, Jessica Hamilton, Lynn Abramson, and Lauren Alloy. Here are their findings. Children raised in single mother families are at increased risk for psychopathology. In a community sample of diverse adolescents and their mothers, they found that single mothers would be more likely than cohabiting mothers to engage in negative parenting behaviors, which would predict adolescent psychopathology prospectively. Single mothers were more likely to engage in psychologically controlling behaviors, which predicted to their adolescent offspring experiencing higher rates of depressive symptoms and externalizing disorders. Girls were more susceptible to depressive symptoms via psychologically controlling parenting than boys in single mother families. This article gives insight on some other health concerns families with single parents might go through. Many people fail to realize the children and parents in these situations are subject to more stress and unhealthy coping mechanisms than coupled parents. This sometimes means that they develop more mental health problems that need assistance. Culturally competent healthcare. The increasing diversity of the nation brings opportunities and challenges for healthcare providers, healthcare systems, and policymakers to create and deliver culturally competent services. Cultural competence is defined as the ability of providers and organizations to effectively deliver healthcare services to meet the social, cultural, and linguistic needs of patients. Cultural competency in healthcare can overcome health disparities such as language barriers, cultural beliefs and practices, unconscious and conscious, medical bias, variations in care access and quality, and low health literacy, according to Global Health Service Company Cigna. The beliefs, behavior, and values that are central to families' cultural may be affected by race, ethnicity, language, class, religion, spirituality, parenting orientation, self-esteem and empowerment, educational, professional background, economic circumstances, geographic location, and other sources. Applying this idea of culturally competent healthcare would make it that much easier for single parents because they wouldn't have to avoid healthcare facilities or hospitals in fear of judgment and or the following medical bills. Here are my references. Thank you guys so much.